Ma'am, that's not how you administer morphine to a combat veteran. The secure medical device in Emma Thompson's scrubs pocket buzzed with the distinct tone that could reshape national health emergency protocols in minutes. I'll adjust the dosage immediately, doctor. Her voice carried the practiced deference of someone who'd spent the week serving medication to medical staff who had no idea she commanded the entire military medical system. What Lieutenant Dr. Mitchell didn't know was that the blonde medical assistant preparing his patient's injection outranked him by 6 stars and was about to receive a call that would change everything. Click. Mitchell tapped his clipboard against the metal chart holder, the sound echoing through Fort Harrison's military hospital. And next time, make sure auxiliary staff understands that combat medicine requires precision, not guesswork. Emma's fitted blue scrubs and form-fitting medical pants had drawn appreciative glances all week. At 32, she maintained the athletic build that came from years of military medical training, though none of the doctors watching her work suspected she'd earned her expertise commanding field hospitals across 4 war zones. The Pentagon medical pager buzzed again. National Emergency Escalation. Doctor, I understand the importance of precision, Emma said quietly, her blonde hair catching the hospital's fluorescent lighting as she leaned over the patient. Medical accuracy can mean the difference between life and death. That's when the emergency pager rang with the tone that would expose everything. Nurse Davis had been watching the new medical assistant for 4 days now, and something felt inconsistent. It wasn't obvious at first. Emma Thompson moved through Fort Harrison's military hospital with practiced efficiency, her fitted scrubs flattering her athletic figure while maintaining professional boundaries. Blonde hair pulled back during procedures, nothing suggesting she was anything more than what she appeared. But Davis had 12 years of military medical experience, and she'd learned to recognize specialized training. The way Emma handled medical equipment wasn't random. She used protocols most auxiliary staff never learned. When she prepared medications, she employed dosage calculations that suggested advanced pharmaceutical training. When she moved through the crowded emergency ward, she navigated with the spatial awareness of someone who understood triage flow and crisis management. Most telling was how she assessed patients. Emma Thompson saw everything. Not obviously. She never overstepped her apparent role as assistant. But Davis noticed her unconsciously evaluating conditions with diagnostic precision. Yesterday, when Lieutenant Dr. Mitchell discussed treatment protocols, Emma had cleaned nearby much longer than necessary, her eyes tracking patient charts with unmistakable medical comprehension. "Davis, you're staring again," Captain Rodriguez mentioned during yesterday's shift. "Just observing staff efficiency," Davis replied. But it was more than that. This morning's incident confirmed her suspicions. Most medical assistants would have apologized profusely when corrected by a licensed military physician. Emma Thompson had done neither submission nor defensiveness. She'd listened carefully, processed the medical authority structure, and responded with calm professionalism that suggested experience managing difficult personalities in high-pressure medical situations. Her body language hadn't shown intimidation. If anything, she'd looked patient, like someone waiting for a resident to finish a lecture. The secure pager buzzed again, its tone cutting through the hospital's constant background noise like a medical alert. "What exactly is that noise?" "Lieutenant Doctor," Mitchell demanded, his voice carrying across the emergency treatment bay. Emma's hand moved instinctively toward the device, then stopped. "I apologize, Doctor. Medical emergency contact." "Medical emergencies are handled through proper hospital channels." Mitchell gestured toward the official communication system. "Young lady, this is exactly the problem with auxiliary staff in military medical facilities. No understanding of proper emergency protocols." But what Mitchell didn't know was that Emma Thompson had been conducting her own medical investigation. As the Surgeon General commanding all military medical operations, she had access to patient care reports and medical leadership evaluations for every military hospital under her jurisdiction. Fort Harrison's medical center showed concerning patterns, nothing dramatic, but subtle indicators suggesting inadequate patient care and leadership issues affecting treatment quality. Anonymous feedback mentioned feeling dismissed by certain medical officers. Patient satisfaction scores declined consistently. Most troubling were bias reports about how different medical staff and patients were treated. So, Emma Thompson decided to investigate personally. Doctor, Nurse Davis interjected carefully, maybe we should keep medical discussions private. Auxiliary staff sometimes overhear sensitive. Davis, she's a medical assistant. She distributes medications and cleans equipment, that's it. Mitchell gestured dismissively toward Emma, who continued preparing IV medications with mechanical precision. These auxiliary workers sometimes forget their place in medical hierarchy. Important to maintain proper boundaries. The pager buzzed a third time. Crisis escalation. Emma's athletic frame tensed slightly as she recognized the escalation pattern. Somewhere in the country, a medical emergency was developing that required her immediate strategic assessment. The same assessment that had coordinated responses to biological threats, pandemic protocols, and combat medical crises. The problem with hiring attractive women for auxiliary positions, Mitchell continued, his voice deliberately loud enough for Emma to hear, is that they think their appearance entitles them to medical opinions. But this is military medicine. Beauty doesn't earn respect. Medical competence does. Captain Rodriguez shifted uncomfortably. Doctor, perhaps we should lower our voices. Should what? Pretend everyone's medical opinion is equally valuable? Mitchell warmed to his theme. That's exactly the thinking that compromises patient care. You need to understand that medical hierarchy exists for a reason. Training matters. Education matters. Distributing pills doesn't mean understanding pharmaceutical science. Emma moved closer to their conversation, her movements carrying subtle authority that seemed at odds with the humble assistant role Mitchell described. That's when the Pentagon medical pager rang for the fourth time. The sound cut through the emergency ward like a code red alert. Not a cheerful personal chime, but the distinct emergency tone of the nation's highest medical command system. Every medical professional in the treatment area turned toward the sound. Emma froze mid-preparation, looking at the device that connected her to the Pentagon's Medical Crisis Management Center. Ma'am, Mitchell called with full medical authority. I told you personal calls wait until break time. Turn that off immediately. Emma looked at the pager ringing with Pentagon medical priority rhythm. 15 years of medical command experience warred with her undercover investigation. Doctor, with respect, this isn't personal. Emma's voice carried quiet confidence that made Nurse Davis pay closer attention. Mitchell's face reddened. I don't care what kind of medical call it is. You're auxiliary staff in a military hospital. When a licensed physician gives direction, you follow. Period. The emergency ward went quiet. Medical staff at nearby stations stopped their procedures, sensing confrontation. Emma's steady hands trembled slightly as she set down the medication tray. Inside her scrubs pocket, the Pentagon medical pager held 15 years of command authority over medical operations spanning global military health care. Lieutenant Doctor. Mitchell, Davis tried. Maybe she should... Davis, stay out of this! Mitchell's voice carried across the quiet ward. This is exactly what I meant. Auxiliary staff who don't understand medical hierarchy. Emma looked around, taking in dozens of medical professionals witnessing this public confrontation. Some looked uncomfortable, others enjoyed the drama. A few seemed to be taking mental notes about leadership behavior. The pager rang again, fifth cycle indicating medical crisis escalation. Ma'am, Mitchell continued with full lieutenant authority, you have 10 seconds to silence that device and return to duties, or I'll have you escorted out and your medical clearance permanently revoked. Doctor, Captain Rodriguez spoke quietly. Maybe we should... Rodriguez, I'm handling this. Everyone's about to see how you maintain discipline and respect in military medical environments. Mitchell folded his arms. Ma'am, I'm waiting. Emma looked at the pager. The secure device that had coordinated responses to national health emergencies advised the Joint Chiefs on medical strategy and participated in decisions affecting millions of lives. For a week, she'd observed how medical leadership functioned at facility level, how authority was exercised, respect earned or demanded, How medical hierarchy affected patient care when senior staff thought no one was monitoring from above. Now she was experiencing it firsthand. "Lieutenant Dr. Mitchell," she said quietly, "you're absolutely right about medical hierarchy and the importance of following legitimate medical protocols from qualified physicians." Mitchell nodded with satisfaction. "Exactly. Now please turn off, but you might want to know," Emma continued, answering the pager, "who you're giving medical orders to. Dr. Thompson, Surgeon General." The silence was total and immediate. Even ventilator sounds seemed to pause as the words registered throughout the emergency ward. "Dr. Thompson, we have a developing biological threat at Fort Benning. Initial reports indicate potential contamination affecting multiple personnel requiring your immediate medical assessment." Emma's entire presence transformed. The blonde medical assistant disappeared, replaced by the commanding medical authority of someone accustomed to decisions affecting national health security. "What's the timeline for my medical evaluation?" 20 minutes, ma'am. Base commanders are implementing quarantine protocols, and we need your authorization before expanding containment procedures." "Understood. Connect me to CDC liaison immediately. I need all biological analysis reports and initial exposure data from the contaminated area." While Emma received the classified medical briefing, she observed the transformation around her. Lieutenant Dr. Mitchell had gone completely still, his face draining of color in dawning medical horror. Nurse Davis looked fascinated rather than shocked, as if diagnostic pieces were clicking into place. Other medical staff appeared to be experiencing various stages of professional disbelief, but Emma's primary focus was on the crisis hundreds of miles away. "Dr. Thompson, we're tracking potential exposure of 43 personnel to unknown biological agent. Symptoms include respiratory distress, elevated temperature, and neurological indicators. No fatalities yet, but condition is deteriorating." Emma began pacing behind the medication station, her auxiliary uniform now completely at odds with the authority in her voice and the complexity of the medical crisis she was managing. "Current containment protocols? Level 2 quarantine, ma'am. Base medical facility treating symptoms, but no definitive diagnosis. CDC team en route. Estimated arrival 6 hours. Recommendation: immediate escalation to Level 3 containment. Full protective protocols for all medical personnel. No personnel movement until CDC analysis complete. And get me secure connection to infectious disease specialists at Walter Reed. Level 3 containment? Yes, ma'am. Secretary of Defense requesting your assessment on evacuation protocols. Tell the Secretary that premature evacuation could spread contamination to civilian populations. We contain first, analyze second, evacuate only if containment fails. Have medical transport on standby but maintain quarantine integrity." Lieutenant Dr. Mitchell finally found his voice, barely a whisper. "Surgeon General?" Emma held up one finger, indicating she needed to complete the medical crisis call. Around the emergency ward, medical staff at other stations began realizing they were witnessing something extraordinary. Phones were quietly retrieved. Conversations stopped entirely. "Dr. Thompson, we're also receiving reports of similar symptoms at civilian hospital 20 miles from Fort Benning. Possible civilian exposure? Almost certainly related. This is testing our containment and response capabilities. Recommend immediate civilian health department notification and Protocol 7 implementation for all regional medical communications." "My Protocol 7 implementation, yes, ma'am. Anything else?" "Hourly medical updates on both military and civilian cases. If either contamination spreads or symptoms worsen, I need immediate notification. And get me secure line to Surgeon General of Public Health Service. We may need coordinated civilian-military medical response." "Understood, Dr. Thompson. Hourly updates and secure connection established." Emma ended the call and looked around the completely silent emergency ward. Every face was turned toward her, expressions ranging from medical shock to professional awe to terrified recognition. She turned to Lieutenant Dr. Mitchell, still staring with the expression of someone watching their medical career disintegrate in real time. "Lieutenant Dr. Mitchell, I believe you had concerns about auxiliary staff understanding medical protocols?" What followed was the most uncomfortable 40 minutes in Lieutenant Dr. Mitchell's 8-year medical career. Dr. Emma Thompson, still wearing her fitted auxiliary scrubs, conducted an impromptu medical leadership evaluation that would become legendary throughout the Army's Medical Command Development Program. "Medical professionals," she began, addressing the 6 staff members who remained frozen at their stations while other personnel quietly evacuated to give them privacy. What happened today wasn't a medical accident. It was the predictable result of leadership attitudes I've been documenting at this facility. Nurse Davis leaned forward, her medical training engaging. "Doctor, what exactly have you observed?" "A systematic patterns of discrimination based on appearance, gender, and perceived medical status rather than actual competence. Troubling tendency to dismiss input from anyone considered lower in medical hierarchy." Emma pulled out a small medical notebook. "I've documented 19 incidents of medical officers making patient care decisions based on assumptions about auxiliary staff, gender, or civilian status rather than demonstrated medical capability. Lieutenant Dr. Mitchell felt his medical career prospects evaporating. "Ma'am, I never intended any medical disrespect." "Lieutenant, medical intentions matter less than patient care impact. Medical leadership effectiveness is measured by how behavior influences treatment quality, staff cooperation, and patient outcomes." Emma flipped through her notes. "Your interaction with me today was consistent with patterns I've observed in your medical leadership style throughout this week." She turned to Davis. "Nurse Davis, you consistently questioned medical assumptions and advocated for procedural verification. That's the critical thinking that creates effective medical leadership." Davis felt simultaneously relieved and terrified. Being praised by the Surgeon General was career-enhancing. Being praised for questioning a lieutenant's medical authority in front of that Surgeon General was potentially career-ending. "Captain Rodriguez, you showed discomfort with today's conversation direction, but weren't willing to speak up when witnessing inappropriate treatment of someone you believed had no medical authority to defend themselves. That's a leadership failure with serious patient care consequences." Emma closed her notebook. "Here's what happens next. Lieutenant Dr. Mitchell, you'll report to Colonel Harrison's office at 0900 hours tomorrow. Your comments about auxiliary staff, medical competence, and appropriate treatment indicate immediate need for medical leadership development and bias recognition training." Mitchell nodded numbly, calculating the damage to his medical advancement potential. "Nurse Davis, you'll join me for discussion about advanced medical leadership opportunities. Your willingness to question conventional medical thinking indicates potential for strategic-level medical responsibility. All of you will participate in comprehensive facility medical climate assessment. This includes confidential input from all levels: auxiliary staff, nursing personnel, patients, and medical officers." Emma stood, her auxiliary clothes somehow failing to diminish the medical command presence radiating from her athletic frame. Medical professionals, modern military healthcare requires leaders who recognize medical talent regardless of packaging. The ability to see beyond surface appearances and initial assumptions isn't political correctness. It's medical necessity. She looked directly at each medical professional. Today you had the opportunity to demonstrate those medical qualities. Some succeeded, others failed dramatically. This morning's incident will become a case study in medical leadership programs throughout the military. Not because Lieutenant Dr. Mitchell failed to recognize the Surgeon General, but because he failed to treat another medical professional with basic dignity and respect. Davis raised her hand. "Doctor, what changes do you recommend for Fort Harrison?" Fort Harrison becomes a pilot program for inclusive medical leadership development. We'll prove that patient care improves when every medical professional is valued for actual contributions rather than perceived status or appearance. The auxiliary program will be expanded and formalized. Medical expertise in specialized care, patient advocacy, and treatment coordination will be systematically integrated. Most importantly, we'll train medical leaders to recognize and develop medical talent wherever they find it. As she walked toward the exit, still wearing her auxiliary scrubs, but now carrying herself with unmistakable Surgeon General authority, the remaining medical staff sat in stunned silence, each contemplating how a simple medication procedure had fundamentally changed their understanding of medical leadership, assumption, and the dangerous cost of underestimating medical professionals based on appearance. 6 months later, the Surgeon General in scrubs had become Army Medical Corps legend. Lieutenant Dr. Mitchell received transfer to medical research at Fort Detrick, effectively ending his clinical advancement possibilities. His evaluation included mandatory bias recognition training and ongoing supervision requirements. But the impact extended far beyond one medical officer's career. Nurse Davis was promoted to nurse practitioner ahead of schedule and assigned to Pentagon medical planning, where her demonstrated ability to question medical assumptions proved invaluable in preventing 2 potential healthcare crises. Captain Rodriguez received additional medical leadership development focused on moral courage, the strength required to speak up when witnessing inappropriate treatment of medical colleagues. The Fort Harrison incident became the centerpiece of a new Army-wide program called Medical Leadership Beyond Appearance. The program trained medical officers to recognize clinical talent regardless of gender, age, or auxiliary status, proving that patient care depended on seeing beyond surface medical assumptions. Dr. Emma Thompson was promoted to Deputy Surgeon General 6 months later, becoming the highest-ranking female medical officer in Army history. Her promotion ceremony was held at Fort Harrison, with over 300 medical professionals in attendance. Medical leadership requires the humility to recognize that clinical wisdom can come from unexpected sources, she said during her speech. It requires the courage to question your own medical biases, especially about the worth and capability of other healthcare professionals. The auxiliary program at Fort Harrison expanded to include former medical executives, retired specialists, and experienced healthcare professionals whose civilian medical expertise enhanced patient care in ways traditional military medical training sometimes couldn't address. But the most significant change was cultural. The incident sparked Army-wide conversations about medical respect, assumption, and hidden potential in every healthcare professional. Medical officers questioned their biases more carefully. Auxiliary staff felt more valued. Patients experienced improved treatment and greater medical advocacy. The goal wasn't to embarrass anyone or prove points about hidden medical identities, Dr. Thompson explained to a military medical leadership conference. The goal was creating medical leaders who see healthcare professionals clearly, value contributions based on medical merit rather than appearance, and understand that our healing strength comes from recognizing and developing medical talent wherever we find it. Fort Harrison's emergency ward installed a small bronze plaque near the medication station. Medical excellence is best measured not by how you treat those with authority over you, but by how you treat those who appear to have no medical power at all. Every day, medical professionals sharing patient care were reminded that everyone around them carried medical stories, experiences, and healing capabilities that couldn't be judged by uniform, job title, or first medical impression. Sometimes the person administering your medication commanded entire medical systems. Sometimes the quiet observer had medical insights that could save thousands of lives. Sometimes the most powerful healer in the room was the one everyone medically underestimated. If you believe every healthcare professional deserves respect, regardless of their current role, type "respect" in the comments. Subscribe for more stories where true medical leadership reveals itself when people think no one important is watching. Support our mission. Link in the first pinned comment. Until next time, remember, never underestimate the healing strength that walks among us every day.